I am Rabbi Sarah Berman, and it is my honor and my pleasure to welcome not just you, but all of our panelists this evening for our BRCA Journeys, a storytelling event. You may notice that as you enter our Zoom room, you have been lovingly muted. We appreciate you and appreciate you being here and want to hear your questions, but we want to hear your questions with our eyes. So we will ask you to post any questions that you have through this program into the chat box. And if you post it to everybody, then everybody can see what's on your mind and what is of interest to our community here. This storytelling event is part of a larger project at Central Synagogue called Sharing Our Stories. It's an opportunity for our community to get to know each other better through our sharing of our own personal stories, our own journeys in various aspects of our lives. Tonight, we're talking about BRCA journeys, the genetic mutation that makes us more susceptible to various types of cancer. We are so pleased to be partnering with the Vassar Center for BRCA on this program. And as you will all hear this evening, while BRCA mutations disproportionately impact the Ashkenazi Jewish community, BRCA mutations are found in all racial and ethnic groups. And in planning tonight's panel, we wanted to make sure that we heard stories from a diverse panel of people from across the spectrum of experience. I want to give a special thanks to all of our panelists for tonight's program. It is courageous, an act of courage for all of you to be with us and to share your personal stories so openly. And I know that each of you feels strongly about advocating for your own health and for that of your families, and for raising awareness across communities. And we will all be inspired by your stories and your journeys this evening. Central Synagogue has had a long-standing educational partnership with the Vassar Center, and this is our third event together. Many of you in the Central Synagogue community know that the Vassar Center's founders are dedicated members of our community, and I would like to invite that founder, Mindy Gray, now to say a few words. Here we go.
Hi, everyone, and thank you, Rabbi Berman, for welcoming the Vassar Center to be a part of Central's year of storytelling. It is, as you said, great to continue the collaboration between two places in my life I hold dear. My husband, John, and I founded the Vassar Center in 2012 after the unthinkable loss of my sister, Faith Vassar, to BRCA-related ovarian cancer when she was just 44 years old. And it's really evenings like tonight that can spread awareness and spare the lives of family members and loved ones. You are in for a treat tonight. Dr. Susan Domchek, the Vassar Center's esteemed and compassionate director, is going to be moderating a fabulous panel. And as you said, special thanks to our panelists for opening their hearts and minds. I know this is never easy to share your personal stories. It takes a lot out of you. So truly, from the bottom of my heart, thank you. And finally, my great wish is that each of you leaves inspired to dive deeper into your own family's history. Had our family known more about ours, my sister may still be alive today. So thank you.
Thank you, Mindy, so much, not just for joining us tonight, but for everything that you've done in your sister's memory and bringing that to us. So thank you. It is now my honor to introduce Dr. Susan Domchek as our moderator this evening. Dr. Domchek is the Vassar Professor in Oncology at the Perelman School of Medicine at the University of Pennsylvania. She serves as the Executive Director of the Vassar Center for BRCA at the Abramson Cancer Center. And she's also Director of the Marianne and Robert McDonald Cancer Risk Evaluation Program there. Dr. Domchek's work focuses on the genetic evaluation and medical management of individuals with inherited risk factors for cancer. Dr. Domchek is particularly interested in developing new cancer therapies, such as PARP inhibitors for breast cancer due to genetic risk factors. Welcome, Dr. Domchek.
Well, thank you so much, Rabbi Berman, and everyone who has joined tonight's call for this program. We're thrilled to continue our educational collaboration with Central Synagogue. Our panelists include Central Synagogue community members Marcia Caban, Sue Dorn, Gary Furman, and Karen Kennedy, as well as Vassar Center Young Leadership Council member Ashley Dedman. I'm going to introduce them one at a time. So first, Marcia Caban, Central Synagogue's executive director, grew up in a family where she describes that it was more common for women to have survived breast cancer than not. And she learned that she had a BRCA2 mutation. Karen Kennedy, daughter and sister of Central Synagogue members, is a fourth-generation breast cancer survivor diagnosed at the age of 32. Karen tested negative for a BRCA mutation and will share her experience with us as well. And a very important story about the fact that the BRCA1 and 2 testing isn't everything. In addition, we have Gary Furman, who my papers fell out of order, so I apologize. Just give me one second. A member of the Central Synagogue community. He is a breast cancer survivor with a BRCA-related and unrelated cancers in a number of relatives. Gary has a BRCA mutation and feels strongly that the story of male breast cancer needs to be told. Gary will talk about his experience advocating for himself to gain knowledge and lower his risk. Sue Dorn, Central Synagogue member, was diagnosed with breast cancer, and her oncologist recommended genetic testing given her family history of breast cancer, including her mother, who had passed away several years before. Sue tested positive for a BRCA1 mutation and underwent a lumpectomy and radiation. Ashley Dedman is an active member of the Vassar Center's Young Leadership Council and has been a fantastic partner in educating communities of color about hereditary cancer. Ashley was a teen caregiver of 2 parents with cancer. She learned that she carries a BRCA2 mutation, and during her journey, she offered The Big Discovery, a children's book that helps guide families through a breast cancer diagnosis. She will share her experience regarding reducing her risk for developing cancer. So thanks to all the panelists for joining this evening and for sharing your story so openly. I think you'll hear that this is going to really give us a breadth of the types of experiences that people have, and no one story is alike. Before we hear more from the panel, I just want to get some basic facts out of the way, if you will, genetics 101. So BRCA1 and BRCA2, as the genes are called, are genes that everyone has. You inherit one copy from your mother, and you inherit one copy from your father. The proteins that these genes make, BRCA1 and BRCA2, are good. They actually help repair DNA damage in the cell, a specific type of DNA damage called double-stranded break by a process of homologous recombination, which are big words just to say that these proteins are incredibly important in keeping the cells healthy. As such, BRCA1 and BRCA2 serve as tumor suppressors, so we call them tumor suppressor genes. If a person inherits one bad copy of either BRCA1 or BRCA2, this increases the risk of cancers fairly dramatically. We call a bad copy a mutation, or another word that's often used is pathogenic variant. It doesn't help that we've changed our nomenclature, and we used to always say mutation, and now more commonly you'll hear pathogenic variant. But it just gives you an idea that these are specific changes in the DNA that if you inherit those changes, it increases your risk of breast, ovarian, pancreatic, and prostate cancer. It's also important to realize, as I said before, that half of the BRCA mutation carriers in the world are men, and that you can inherit a bad copy from your father. So although these pathogenic variants or mutations can occur across all races or ethnicities, 1 in 40 individuals of Ashkenazi Jewish descent have a mutation in either BRCA1 or BRCA2. In the general population, the non-Jewish population, that rate's about 1 in 300. There are a lot of myths about these mutations that we are trying to dispel tonight, and our experiences, our panelists' diverse experiences, I think will help tell this story. So for that, we're going to get started. Again, if you would like to ask a question, please put it in the chat. But for now, we're going to get all the panelists up on screen and we're going to get started. So as everyone starts to pop up on screen here, Zoom is so weird. It's so much better to do these in person, but we've got it. We are going to get this right. So my first question is for Marcia. So when we were preparing for this evening, you shared the news, that shared the fact that when you first got the news, this was at first really devastating, but that you really learned how to use this information to help protect yourself. So tell us about that process, about how you made your decisions to lower your risk.
Thank you so much, Susan. And I just want to, again, thank the Vassar Center and all of our staff and congregants and community members for coming today. It's really something that is obviously very close to me. I come from a family of 5. Everyone has had cancer, 2 people twice. My father had cancer and my brother died. You would think in that family, you would talk about how you can help each other and learn and keep yourself safe. But, starting when my mom's first cancer was when I was 9, she got it right before my brother's bar mitzvah. And she was very proud that she didn't share, she powered through it. She didn't share, she had the bar mitzvah. And it was kind of this thing that we always knew was out there, but we never really talked about. And then when genetic testing became more available, my mom went out and got tested because she, like something flipped, like I can do something now to protect myself and protect my family. And without talking to us again, she went out and she got the test and she found she had the mutation. And then we were all, getting the test and we were going to have ovarectomies and do what we could do to protect ourselves. And I would say that when I first learned, because my sister at that point had hit cancer, my mother had had cancer twice, I was kind of in denial that I was going to get a positive result because I hadn't had to deal with cancer. And when I got that slip of paper, which I will never forget that day, sitting in my office and reading all of the cancers that you now have to think about and protect yourself, it's overwhelming. And it was very difficult. I was a young mother at the time and it was hard. But I would contrast that with about 8 or 9 years ago, my sister got bile duct cancer. And then my brother sadly died of small bowel cancer. So now we have a family with 2 rare, gastro-related cancers. And I just, at that point, just took action. I went and spoke with any doctor I knew. What should I do? What kind of screening should I add? And it was just, it was like now that I feel like I have more control and I can't protect myself fully, but I can do things to screen and make myself safer. And also I openly talk about it with my daughter, who's 26, so she can get information she needs and educate herself to make choices that are the right choices for her. Just feels like a very different journey from, the generations where this was just not spoken about to now having information that can empower us to make choices to protect ourselves and stay healthy.
And I really want to emphasize that point. It wasn't that long ago where people didn't talk about cancer, period. They didn't, tell when they'd had cancer to other people. And it was hard to figure out what people in your family died of. Nobody talked about it, or it was a female cause or things like that. And I think we've gotten better about this, and we're still not great. And we still have families that don't communicate very well. And believe me, all families have their moments. But now we have to move on to the next piece, which is about genetics. And we're going to see that theme again and again tonight about how important it is to talk to your family, even when it's hard, because it's not always easy to sort of talk to that cousin or someone that you don't know very well. But as you've really clearly articulated, Marcia, how incredibly important and impactful it can be for an individual. So talking about things that are difficult to talk about, Gary, you've had a very, different experience. We talk about, I'm wearing pink. It's October. It's Breast Cancer Awareness Month. I have plenty of blue too, by the way. But this is a problem. We talk about breast cancer as if it's only something that women can face. But we know that men can get cancer, and that's a very different experience. So can you tell us what your experience was like?
Sure. First of all, my story is quite raw and recent. So I've only really shared it with close friends and family. But as Susan mentioned before, I feel incredibly strongly that, this story of male breast cancer has to be told, to educate, a complete lack of awareness of, from most of the population. So anyway, it's something I wouldn't typically share, particularly something so private, but I really felt sort of compelled. And I think it's a great forum. Obviously, I'm a big fan of Vassar, and I think this, sort of delighted to tell, this, incredibly private story. So about 2 years ago, I discovered a mass on the right side of my chest, and I didn't really think much about it, because frankly, breast cancer for men was not on my radar. So, I, sort of first day, after I worked out, I felt it, but I didn't really do anything about it. And I felt, it was sort of interesting. I think of myself as really an educated consumer when it comes to cancer. My brother's a surgical oncologist. I've had other cancers before, and my mother had breast cancer and other cancer and passed away. My father had prostate cancer. So, when I, got this, I didn't really think it could be anything the first day. But then, sort of my radar went off the second day, and I said, well, maybe men can get breast cancer. And I sort of started doing some research and said, okay, well, lo and behold, men can get breast cancer. So the second day I said, well, I better do something about it. But, I sort of am embarrassed that as an informed consumer and someone, that should know, I didn't know. And I went through the journey with my mother. I had never been tested before, but, that was, a, sort of a peculiar thing. So, I went to my lymphoma specialist and said, what's this? And he really, said, you know what, you should go see a radiologist. So my journey was, I go to a radiologist, happened to be a man. He basically said, we can just watch it. Maybe we can get you a biopsy, but really just totally said, don't worry about it. So that was kind of the message that I wanted to hear. So I ran right out of there and I said, okay, I'm good. But then the next day I said, wait a second, that doesn't feel right to me at all. So I went back and I got an appointment with the female radiologist, and turned out she went to Penn. She was a year behind me. And she gave me an entirely different picture. I saw in her eyes, and she was deeply concerned. And I didn't leave her office for 4 or 5 hours. And she did a lot of uncomfortable things, because I don't have, any major tissue there. So, I sat there. She, sort of delayed other things she had to do. And she said, listen, I've got you. She gave me her, cell phone number. And she said, I'll be back to you as soon as I can. So I didn't go to work for a couple of days because I had that eerie feeling of the last time I found a mass. And I said, this does not feel right. She called me and she said, I had breast cancer on both sides, and you should go see my friend Elisa Port at Mount Sinai. So I ran over there. I knew Elisa of her because she had treated a number of my female friends. And that's sort of what happened. And again, I had never been tested, so I didn't know that I was a carrier. But she said, you know what, it doesn't matter. You need to, you need to have the surgery. So, but go see genetic testing. So I did that. And literally, as I was being wheeled into surgery, Lisa said, it makes sense. You're BRCA2. This all makes sense now. So, that was sort of my experience. I felt like an idiot not knowing. I felt really sort of strange about it. Elisa told me I do 450 surgeries a year, 450 to 500, maybe 3 or 4 men, and I've never done a double mastectomy before. So I said, well, it's not a club I want to be the only member of, but it sort of got me thinking. So after a year and a half or so, or 2 years, I felt I really need to tell this story because, I should have known. I didn't know. Every man that I've told or alluded to it said, I didn't know men could get it. I mean, these are very informed people. So, it's just not out there. And I think it's super important for your loved ones, family, other family, members, etc., to really know. And, and I think it's a different issue for a man and for their children when they would get tested. Obviously, young girls or young women are different than, when a male can get tested, other than I guess there's a life insurance issue. But I just feel like, someone should go on a soapbox and sort of shake men and say, this could be, a real problem. And some of the men that knew of somebody, they didn't take care of it because that's not often what men do, and they passed away. So it's just something that I just feel so strongly about. And when I heard about what John and Mindy did, and obviously Susan, I know you, I said, this is something that I absolutely need to lean into and figure out and be helpful. So that's my story.
Gary, I want to emphasize how much we appreciate you telling your story, because this is the only way this happens. It's like that telephone game, and they tell 2 friends and they tell 2 friends. Our men are not always the best at going to the doctor, but you were, by the way, and you went back. I can tell you that 99% of people wouldn't have gone back. So you went back, which is. And
I still remember the guy who just like, you serious? You were going to send me away and say, go back 6 months later.
Yeah.
I mean,
that's just terrible. So this is how we get the word out, is that we tell these stories, and all the women on this call, I always want, someday I'm going to get on one of these calls and half of the people on the call are going to be men. We're not there today, but some of these days we are. And that's what I want every woman on this call to go home and talk to their men folk about this, because we really do need to get the word out. By the way, it's not comfortable for women to get mammograms too, but I hear you.
It was tough.
Yeah, it's not a fun experience. But, so again, we're gonna ask you more follow-up questions, because I think your perspective is so important. Now we have Ashley, who, as we said in the introduction, you started your cancer experience, if you will, when you were a teenager, helping to take care of your parents. So now that's really tough. So tell us how that's informed your story.
Thank you, Dr. Domchek. Thank you, Rabbi Berman, Mindy, and the Vassar Center for this opportunity and for creating this safe space to have this conversation. So I was 18 when my mother was diagnosed with metastatic breast cancer. I come from 3 generations of women, all on my mother's side, my maternal side. My great-grandmother, my grandmother, and of course my mother all died from breast cancer. I was 18 years old, and it was very devastating in how we found out. My mom had some back pain from a fall that she had taken, and we had taken her to the ER. I was playing club volleyball, and she had fallen going into our hotel room while we were at a tournament. And so when we returned home, she was having back pain. So we took her to the ER, and that resulted in a stage 4 breast cancer diagnosis. And the doctor had told her, the doctor told my dad in a very just short way. He said, you know, your wife has stage 4 metastatic breast cancer. She has 6 months to live, and he walked off. And I was 18 and I was in the waiting room, and I heard this big thump. And as I kind of peeked around the corner, I saw my dad's head hit the wall as he slid down the wall, crying out for his wife. And because to us, she was a wife and a mom. And, you know, maybe to him, she was just another patient, but she was so much more than that to us. And so over the course of her journey, she underwent hormone therapy, chemo, and radiation. And she passed away about 2 months shy of my college graduation. I know she was trying to hang in there, but her body just needed to rest. And so shortly after, my dad was diagnosed with prostate cancer. And Susan, it was then I was scared. I was 18. Well, now I'm sorry. Then I was 21 years old. I had just lost my mom. And now my dad was informing me that he had prostate cancer. And so I was scared. And the big question was cancer coming for me? And so I graduated from college and I returned home I live at home with my dad because we had just lost my mom a couple of months before. And so we were both still grieving. And my dad now was diagnosed. And so while I went from a caregiver for the caregiver for my dad, who was the primary caregiver for my mom, I now was the primary caregiver for my father. And so while my mother had gone through her journey for 4 years, I was, even at the age of 21, very familiar on what that journey would look like. Very fortunately, he had his prostate removed and is a prostate cancer survivor. But it was then I had questions. So I reached out to my doctor and I updated her on my family history. And that's when I was introduced and talked to about genetic testing and counseling. I was very fortunate to have pre-counseling. Then I received my results, and then I had post-counseling. So that's very rare. So I feel very privileged and honored to have had pre-testing and post-testing. And so at the age of now 22, I began seeing a high-risk oncologist. Now, mind you, my mother had just passed away a few months before, so I was still very scared because now I was seeing an oncologist, a doctor that was very similar to what my mother had seen. And my doctor started talking to me about risk management options. She started talking about hormone therapy, which would drastically reduce my risk, probably around 50%. We talked about increased surveillance, which would aggressively monitor my breast and ovarian health. And then, of course, prophylactic or preventative procedures, which would drastically reduce my risk. But Susan, I was so overwhelmed, and it was just so much information to take in. Because I still didn't know what having this mutation meant. And so it really, at the time I was a health teacher, I started my career as a health teacher. And so I remember just going to a science teacher's classroom and just opening up the science book and going back to basic genetics, And so, of course we get half our DNA from mom, half from dad, but I just started really educating myself on what it meant to have this gene. And like you said earlier, it's a tumor suppressor gene, learning that we all carry this mutation. It's, finding out if it's mutated. And so I did increase surveillance for about 10 years. And then I became a wife and a mom, and I kind of saw myself going down the same patterns as my mom. And that was not making my health a priority. But this time I knew better because I knew what my risks were. And so after having my first daughter and being able to breastfeed her, because that was so important to me, and I didn't want to take that experience away from me or from her, my husband and I, we prayed about it. We talked to my high-risk oncologist, and we decided to explore other options. And at the age of 31, I had a bilateral prophylactic or a double preventative mastectomy to drastically reduce my risk. And I really felt like, I was empowered by my decision, but I was not prepared for the mental and emotional journey of removing my breast at a young 31-year-old, as a young 31-year-old woman. I began to question and challenge, my worth and my value, how I looked and how I felt and how I looked to my husband. And even though I know I made the right decision, kind of fast forwarding now, I have almost a 2-year-old. When I was pregnant with her, I kind of just would beat myself up. Like, what did you do? You're not going to be able to breastfeed this baby. But I know I made the right decision. And so I had to really get past that mental and emotional, that psychosocial component of my journey, knowing that I made the right decision to reduce my risk, because I have my daughters that I need to be here for. And then finally, I'll say, and I always share this, breast cancer aggressively attacked 3 generations of women in my family. And it was through genetic counseling and genetic testing that me and my girls can preemptively attack breast cancer, because now we know our risk and we have risk management options. And so we have that, knowing that I carry this mutation is kind of our new blueprint of our standard of care. And then I will say, this past February, my dad, after almost 12 years, underwent genetic testing because he had prostate cancer. And I had to really allow him time, first to grieve his wife, to second, go through his own prostate cancer journey. And then third, really learn the meaning of, genetic testing. And so he went through genetic testing and he was negative. He did a single site test. He didn't do a full panel test at this time. And he found out that he was negative for the mutation. So now I can confirm that I did inherit this mutation from my mom. And so I have that closure. And now it's just equipping and preparing my daughters to know that they have a 50-50 chance, making them aware of their family history, making them aware of my mutation, and being proactive to protect their breast and ovarian health.
Well, thank you, Ashley. It's an amazing story. And I think you've hit so many important topics, one of which is it's a journey that people can screen for a while, and then they can think about their surgeries. That, for instance, having a child and breastfeeding was particularly important to you. Everyone comes to the table with different things. They have a different lived experience, a different family history, a different preference about childbearing and breastfeeding and everything. The job is that what we want is everybody to have a quarterback to help them through this time, right? And not all decisions need to be made in the moment. There are things that can be made sort of over time. So I think that you have really articulated that incredibly well. And I will speak for so many in this field, and particularly for the Bassler Center, prevention, is the thing we want to do, non-surgical prevention, right? So we want to have different options for your daughters than you had. Not that that they are effective options, but we want to have options, not
Exactly.
Yeah. So thank you for that. For Sue, you have a very interesting story in your family. And when you were diagnosed with breast cancer, you were found to have a BRCA1 mutation, but you were also in a study where a pathology sample from your mom's prior surgery was analyzed. So tell us about that and how this information helped your family.
Oh, firstly, it was 24 years ago, one morning, when I got out of the shower and I realized that, or felt that one of my breasts was more dense than the other. And I had had a mammogram only a few months before and thought, oh, well, I don't know what this is. But it bothered me all day because my mother had, in fact, had breast cancer a few years before, and a number of her brothers also had had prostate cancer or some form of cancer. There was none on my father's side. So I did call my gynecologist, who saw me that day. And the next day I already had a biopsy, which said that, yes, I did in fact have breast cancer. My mother, being a few years earlier, had had a mastectomy because that's what they did. I was fortunate in that I had a lumpectomy followed by radiation And then the oncologist suggested that I have the genetic counseling and test. We found out that I did have the BRCA1 mutation, and then was asked, as you mentioned, to be part of a study at the University of Washington that Dr. King was doing. Anyway, she asked then if my mother had had the BRCA gene, and I said, well, they weren't doing counseling then, they weren't testing them. So she said, well, we can test her now. And I said, but she's gone. And she said, no, if you sign a release to the hospital, they can give a pathology slide that they have from before. Well, she did in fact have the gene. And that's when everybody in the family, and she was one sister with 7 brothers. So there were a lot of people to be tested, but they did get, I was lucky that my daughter, my sister, my brother do not have the gene, but several of my cousins did. And one found out that she already had it and has since passed away, younger than I, and another has been a successful survivor. And I also was advised to have a hysterectomy to avoid, hopefully avoid ovarian cancer. So I have been on a soapbox telling everybody to get tested. So
Well, Sue, I'm gonna, one follow-up. You managed to get a lot of people in your family to know about this and get tested. What was your secret sauce? It's not always easy to talk to family members. How did you get them all on board?
well, everybody loved my mother and saw her suffer. And because I got mine early, I didn't have that. And so the whole thing was, you've got to get it early. And then be constantly tested, do regular mammograms and stay on top of it, because that's the secret of survival. And so that worked.
Yep.
And I think also the fact that they were part of a study and didn't have to pay for it.
There's that too. And I will tell, that I'm gonna answer a lot of the questions that are coming in the chat. I will say about the cost, because that often is a deterrent. Testing, the cost of testing has come down massively. If you meet criteria for testing, it's usually free. And even if you don't meet criteria for testing, it costs like $250 these days. So one of the questions in the chat was, that both of someone's brothers had prostate cancer, but sort of he himself was being dissuaded, or she, I'm not sure the name, dissuaded from testing. No, if you have a family history that's significant, you can just go get testing these days. And if someone's sort of blocking you from that, ask around, because definitely you can go get testing. It can be helpful for the person with the cancer to get tested first. It's what we call most informative. But if people balk, then skip them. That's what I often say. We give them a chance because it can be very, very helpful for the person with the cancer to be tested first, but it's not a requirement. Another question is going to come up as we talk to Karen. So Karen, last but certainly not least, you have shared your story that you are a 4th generation breast cancer survivor. And despite this, to date, at least, you have your family has tested negative for BRCA1 and BRCA2. Sometimes it can be a little lonely though, when you have this dramatic family history and you're like, wait, our family, something's going on here too. So tell us about your experience.
Okay, thank you, Susan, and everyone. It's really been a fascinating experience listening to all of your stories. I am a 4th generation breast cancer survivor. My great grandmother and great aunt passed from breast cancer in their 70s. And my mom, who's a very active Central Synagogue member, was diagnosed at age 47, so premenopausal when I was in college. And so I guess my story starts with knowing that information, and it was right around when testing was starting to happen that we enrolled well, my parents helped me to enroll in an early surveillance program at Sloan Kettering when I turned 30. And the theory there was that I would get annual clinical breast exams, be vigilant, and start mammograms when I was 35. 2 years later, it was the I guess it was the end of 1998. I was training for my first New York City marathon, and there was blood in my sports bra. So I went to the doctor, and she's like, I think we should do your mammogram now. Fast forward, I'll spare a lot of the gory details, but I was found to have some papillomas, which they then removed and discovered a tumor sort of, way deep down in. So this was December 23rd, 1998, and there was nowhere really to go. Like, all the doctors were on vacation. So we turned to a genetic counselor, and that was the first step that I really remember finding some way for our family to get together and try to make sense of what maybe we might have known was coming, but that was our first step, was to genetic counseling. I don't exactly remember at what course that I found out that I was negative, but certainly that I was negative gave us some relief. But we do know that there is something going on in our family. There's actually, I was going to talk about this a little bit later, but there's also cancer on my dad's side. His sister was diagnosed with breast cancer. My dad has had prostate cancer. So I do think we're exploring some other testing options now, especially from being, here on this panel, and the new gene that we know was just discovered. But just, quickly, then in terms of the BRCA, I went and got a mastectomy done on one side to get rid of the cancer. And then there was talk, of course, of what are you going to do on the other side? So after the first side was done, I went to my oncologist. He said, well, what do you think about the other side? I said, well, we think there could be something going on, but I'm not ready to deal with it right now. He said, well, if you think you're going to do something on the other side at some point, we may as well do it now, so we have all the information that we can. Plus, we knew we had something genetically going on. So I went in and had the prophylactic on the other side, followed by reconstruction and tamoxifen and all that kind of thing, which then led to fertility issues and a whole other host of things. And that's another journey that my family and I went on. And I was single when this all happened. So it also presented its own, unique issues going through all of this. But, fast forward, I have 3 children all born in the same year through different methods, and, feel very happy and healthy and grateful, and taking the information that we've learned to try to protect the rest of my family. And I can get into that, a little bit later, but anyway.
Well, that must be fun birthday parties. That's to space those out. So, and there was a year they all learned to drive. So we'll just all leave you with that.
Yeah, exactly.
Right now. So I wanted to, because it answers one of the questions that's come along. Yes, BRCA1 and BRCA2 are the genes we most commonly talk about. The cancers that are associated with those genes, they're different, BRCA1 versus BRCA2. BRCA1, breast cancer, largely what we call triple negative breast cancer, which doesn't respond to hormones. Ovarian, that risk, lifetime risk for women is up to 70%. Ovarian cancer, lifetime risk up to 50%. And a small risk of pancreatic cancer for BRCA1, which goes from 1 to 2% to 2 to 3%. There may be an increased risk of prostate cancer. The men get hit a little harder for BRCA2. So there, the BRCA2 mutations, lifetime risk for women around 70% again for breast cancer, mostly estrogen receptor positive. The risk of ovarian cancer is lower, but still up to 20%. But male breast cancer now really kind of starts to really go up, and that lifetime risk is in the kind of 7 to as high as 10% range. The risk of pancreatic cancer now is up in that 7% or higher range. And aggressive prostate cancer is now also kind of comes in here with significantly elevated risks. So BRCA1 and 2 are the ones we know the most about. PALB2 is a gene we've actually known about for a little while, although the New York Times just discovered it, but we have actually known about it for a few years. And if you've been tested really since 2013 or so, you would have already been tested for this gene. But if you're a family that doesn't have had BRCA1 and 2 testing really before then, you should go back to whoever did your testing or go to see a genetic counselor about additional testing. There are other genes, although PALB2 is the most like BRCA3 that we've got. And so there are other genes, and that all goes along with it. So I just wanted to kind of hit that sort of, quickly, which is that there are associated other genes. That's why we I talk about it as genes, not hereditary breast and ovarian cancer, because it's not just breast and ovarian cancer, it's other cancers as well. Another real quick question, and then I'm going to take it back to the panelists, but I'm just trying to go back and forth, is that the prostate cancer question, I'm sorry, I misunderstood. If there's two relatives with prostate cancer and you don't have cancer, why test the affected relatives first? Well, let me put it to you this way. If I have a sister and a mother with breast cancer and I get tested first and my genetic testing is negative, there's two possibilities for that. One is that it's a situation like Karen's family where we don't know the gene and I'm still at risk. But there's another possibility. It's Marcia's family, which is my sister has a BRCA1 mutation and I don't have it. And if my sister has the BRCA1 mutation and I don't have it, I'm at the same risk as the general population. We call that a true negative rather than uninformative negative. It's why it does help when the people with the cancer get tested first. So I hope that clarified that. But again, we'll test who we've got in front of us, but it is really helpful to have the people with the cancer tested to really sort this out when the testing is negative. So I'm going to, we talked about this a little bit, and I asked Sue because she's sort of led the way in talking to relatives. But any other thoughts? I'm going to open this up to the group about talking to your other family members about genetic testing. Hard, easy, any secrets? Anyone can jump in.
Oh, I know for me, for my family, it wasn't hard because everyone was aware that my mother had passed away. I think it was when I started to see a high-risk oncologist and actually decided to have a prophylactic procedure. People were questioning, why I was making this decision. They had no idea that I had 10 years of increased surveillance, especially my friends. I know right before I had my surgery, I took a couple of my friends to lunch to explain to them this procedure I was about to have. And then taking friends to lunch got a little expensive. And so I actually decided the October before my surgery, which is also my birthday, to have a kind of a mastectomy party. And it was not to, of course, celebrate, what was happening, but it was to really spread awareness. And I really brought my friends and family in to talk with them about genetic testing and counseling, that I carried this mutation, why I was having this procedure. Because again, they had always known me to be someone who was healthy, and then all of a sudden I'm having this surgery. So I really wanted to educate them and position them to understand. And even in that conversation, a lot of them, again, because this was the first time they had been introduced to this conversation, that it did not make sense to them. So it was, with family, it wasn't as hard. I think within my family, it was a matter of actually talking about how family members had passed away. And then for my father, I think for him, going back to him, explaining to him, not only would, him getting tested help me to have closure, but he has a brother and a sister who both have 5 children each. And if he did carry the mutation, then he would now have to have conversations with his sister and brother and their children. So some highs and lows, but I think what I've learned is you have to share this information at people's comfort level and provide them resources. Vassar has a great platform with resources to help people to learn more.
Gary, did you have a comment, or maybe you're?
No, I think with family members that, and I'll separate young family members from, ones of age. I don't see any reason why, one shouldn't, embrace testing. If you're the person that has gone through the challenge and you're saying, it's important, for you to have, to get tested, to have, sort of full information, and that's going to help other family members, I think it's irresponsible not to get tested. Obviously, if you have young children, it's a totally different issue. And, the first thing I did was get educated from people like you to say, when do I tell, my kids? But, I have a friend that, got tested at 81 and found out, that, and then informed, his daughters. So I just think, putting our head in the sand makes no sense. And I think testing is just critical. And I don't see any reason why someone shouldn't get tested, who's of age.
And I'm going to thank you. And I'm going to just take a minute too, because there are a number of questions on this theme. We've talked a lot about surgical prevention. And I want to emphasize that is not the end game here. That is, we can identify people at risk. We have increased surveillance. We have the option for surgery, but we also have a lot in the pipeline of how we're going to get to a different place with all this. There are a few different possibilities. There are, vaccine approaches at the Vassar Center. We do have a vaccine trial that we are enrolling. We're starting with people who've had kind of early stage cancers, but we have authorization by the FDA to vaccinate healthy BRCA 1 and 2 mutation carriers in an attempt to prevent cancers. Again, that's going to be a journey that doesn't happen overnight, but we have put shots in arms, and that is because people volunteered to receive those shots. And I want to emphasize, no progress is made without individuals who bravely step forward to try these new things. We have there's a very large trial being run out of Austria, looking at a drug called denosumab to prevent BRCA1 related breast cancers. That's just opening up in the US very soon. We are participating in that at Vassar. And we do have hope that certain medications, there are drugs called PARP inhibitors, could they be used for prevention? We have work to do on that, but this is not static. We use the information that we learn through the scientists to say to ourselves, how can we change this course and make it different for the next generation? So that is a real huge goal for us. I did want to, one other question someone asking, I'm trying to do 4 things at once, but usually for daughters, we generally test women at 25 because that's the age that we start breast MRI. For young men, we don't do too much till age 35 to 40. However, some men and women like to do wish to use this information for reproductive purposes. And by that, I mean the technology is available for people to go through pre-implantation genetic testing, which is in vitro fertilization, screen the embryos, and reimplant the embryos that do not have the gene mutation. As you can imagine, this is the right decision for some people. It's not the right decision for other people. The technology is available. So those are some considerations on timing. So I want to, though, give an opportunity to also ask Ashley about issues of diversity and disparities. So could you comment on that? Because this is a major issue that we face in genetics.
Absolutely. And I want to go back to really quickly, the question about daughters. And I'm not a doctor. I do say this as a mama of 2 beautiful baby girls. It's never too early to talk to your daughters about, their body. And it's, of course, when you feel it's appropriate and when you feel it's necessary, but just making them aware of their bodies. If there's ever changes as they're growing up, to be able to share that with you so that you can take that information to the doctor. My oldest is 7 and she is aware of why grandma died. She is aware of my mutation. And I always tell this story. I was driving in the car one day and I see her in the back holding her hand up and she's doing all of this. And I'm like, hey kiddo, what are you doing? She's like, I'm doing my self-breast exam, Mom. And I'm like, okay, cool. Okay. And, you know, it was so cute, but it shows that she watches me and she's aware. And it's just going to make the conversation that much easier that when she does become of age, you know, for her to make her own choice in genetic testing. So I just wanted to add that little nugget. But with going back to Dr. Domchek's question about diversity and disparities, you know, there's three things I will say as an African-American woman, and just reading research with the disparities in genetic testing in the African-American population, there are three things. Research shows that the disparities in the communication of genetic testing from provider to patient, studies show that doctors are not sharing this information to patients of color. And I think it even goes a little deeper to dissect it on either maybe the physician is not comfortable with sharing the information in general, and then also with racism and microaggressions and bias. And so, of course, that's not acceptable. And so it's very important that doctors do communicate genetic testing and counseling to Black patients. And it's also equally important that as the Black community, we learn and have our conversations and learn our family history so that we can talk to our providers and have that bi-directional collaborative conversation with them and advocate for our health and for genetic testing and counseling. The second is that I believe it's less than 1% of genetic counselors are Black. And so as a Black woman, you know, seeing someone who looks like me in different professions is very important. And so I think it's important that we continue to diversify the workforce so that we can have more Black genetic counselors, more genetic counselors of color, especially as we are trying to make more populations aware of genetic testing and counseling. And then the last one, and this is me personally speaking, I really believe that on a policy level, on a systems level, that testing guidelines need to be revisited for the Black community, especially since the disparities in breast cancer are so high. Black women are 40% more likely to die from breast cancer than white women. And so I think there also has to be a look at the policy as well.
Well, that's so great. Yes, and Ambassador we have a few initiatives, and thanks to Ashley for being part of our Black and BRCA initiative. We want to get, you know, more stories out there. As we've all heard tonight, you need to hear stories that resonate in your community in every way. And so we're doing that. We've been grateful because of the Vassar Leadership Council has raised funds so that we actually have now a scholarship at the University of Pennsylvania for a genetic counselor who's underrepresented minority to improve diversity in the field. So a lot going on there. I know we're running out of time, but I want to go Karen and then Marcia and then and Sue. What is it, you know, the take home tonight? You know, Karen, what do you want people to remember about tonight to take home burned in their minds?
Good question. Well, you know, I think when we were talking earlier, we're talking about, you know, how I've been able to communicate with my family. And I have a first cousin on my mom's side who's like a sister to me. And right when this first started, of course, she was by my side through the whole thing. But I think finding out that I had breast cancer at such a young age, you know, and my mom had been such a young age. So she was sort of the next natural, you know, person to be concerned about. And I think together, well, I think I helped her, she helped me. I think what my diagnosis did was help her to be more vigilant and pay more attention to changes going on with her. And she herself was diagnosed with breast cancer just a few years ago, also early stage, like mine was, but it just really drives home the point that, you know, we have something genetic going on in our family that we need to address. And then, you know, that goes to, especially hearing Gary's story, you know, going to my dad and my brother, and what's going on my dad's side, and for my brother, what was happening on our side. My brother has a daughter and 2 sons. So there's all these links that we have to, be cognizant of. So whether I think someone chooses to get testing or not, I still think that's a very personal decision. I do think that when we were going through it, there was a lot of talk, and goes back maybe 20 years, but the feeling was, well, why do I want to know if I'm not going to do something about it? You're just carrying this terrible, burden with you. You'll just continue to be vigilant. And some people would say, which was more my thought, I can't deal with being vigilant and worrying about it. I was fine with the mastectomy. I had a prophylactic oophorectomy a few years ago, because I don't want to worry about being vigilant, whether I'm negative or not, or positive or not. So I think it is a very, very personal decision. And each decision, whether you're have the test and are positive or negative, come with its own challenges and own things to think about. So I think it's just, be aware of your body. Don't be afraid of going to the doctor. Listen to your body, and follow up.
Yeah, and the one point I really want to emphasize, because someone asked a question about it too. If you have a strong family history and your family tests negative, that doesn't mean that you still don't have a strong family history, because you do. So family history still matters. So I think, Karen is the example of family history matters. Genetic testing isn't the be all and end all, although it is absolutely quite helpful. So thank you for that. And Marcia, what's your take home that you want us to have?
Well, I'm just so impressed with how everyone is advocating for their own health. And I mean, brings up, as I listen to all these stories, and Gary, when you said that you didn't take action, I'm just like blown away how you really did take control of the situation in such an incredible way. And it's, when you have a lot of sadness around these things, sometimes it's harder to just put your head down in your job. I love my job, for all the members on the phone. And, but you gotta take care of yourself. And I'm really impressed with, obviously, the work at the Bassett Center. I learned things. My father was just diagnosed with aggressive prostate cancer. He was not advised to go get tested. My father has still not gotten tested. So that's a conversation that I should have. So just doing what you can do to stay on top of it, learn the new things that are happening in the field, because there's a lot, and advocate for yourself and your loved ones, and your friends and, your community, because it can really make a difference.
Yeah, and thank you. And that is so helpful. And before we go to Sue, one of the things that was brought up was that knowing can be really difficult. And one thing that I want to make sure everyone knows is that when we do genetic testing, in fact, sometimes we know that preventive surgery can be an option, but sometimes I want to say, listen, we will never tell you that that's what you have to do. The most important thing is to make sure that you're at risk and get screened, and everything else is a conversation. So don't let it put you off the consideration of testing. Know that the choices are going to be yours. Always the choices are going to be yours, that you'll be provided with information to make the best choice for you. And I think that's really important, because sometimes I think this can sound really scary, and it is, scary. You got to make all these decisions. But it's really, even if you do just the bare minimum of know you're at risk and get breast MRIs, that already can do a tremendous amount in terms of improving how people do. I think you can see Central Synagogue, you have a whole collection of people that if you're out there and you're thinking about it and you're worried, listen, you got people to talk to. They're all right here. So Sue, what words of wisdom for us?
As important as the testing is, and I certainly believe it, I still have to keep pushing self-examination and mammograms, because we need all of the possible tools that we have. As you explained, there's so much more you could do now, but we have a responsibility for each of ourselves to, firstly, to keep checking and not rely on just because I didn't have something 3 months ago doesn't mean 4 months later, something else might not happen.
Susan, can I say one more thing? Yeah. I just, hope is not a strategy. So I think women are much more vigilant typically than men. I think there is a rabbit hole sort of fear, which I certainly share, that once you sort of get going and sort of test and go to doctors, that it goes from one thing to the next. And certainly if you had any significant illnesses, you're bounced around a lot, and one more test, yet another test, yet another test, and it consumes your life. And I think, as you said, that you can manage that, or hopefully manage that with help. So, but putting your head in the sand is not a strategy. Hope's not a strategy. So you really need to advocate for yourself. I found all the masses that I've had myself, not doctors that I was seeing. So, so it just is what it is. No one loves to go get to doctors and get screens and get PET scans and CAT scans and MRIs. So you can manage that. You don't have to do everything, but you need to be your own advocate, or else there's potentially negative consequences.
Well, this has been really fantastic. I think each individual story, I want everyone to go home and think about each of these individual stories, because it really has taught us so much. I would really like to thank Central Synagogue, Rabbi Berman, Beth Stearman at the Vassar Center helped arrange this, and obviously all of our panelists for sharing these deeply personal stories. That will be the reason that people are talking about this tonight. So thank you very much. And Rabbi, would you like to say some words?
Really, I just want to thank all of you for being here, for participating in this panel, for sharing your excellent questions and experiences. But really, most of all, I want to thank all of our panelists and Dr. Domchek, our moderator, for making this such an informative and personal evening. I think that the thank yous are pouring in through the chat, and I don't want to cut that off. But we have reached our time, and I want to respect everybody's evening. So thank you all so much, and we'll look forward to seeing you at further central programs in the future.
Thank you.
Thank you, everybody.
everyone.
Thank you, everyone.